on the campus and Gus as a coach. And that was fine by me. But it was sort of my first lesson. And the other thing that I did, and I'm wandering, I'm babbling, and whenever you want me to stop.
No, Gus is very important.
Gus was very important to me. Then I said, no, well, how do I get it? I mean, sounds so pedantic today. How do I apply to medical school? I'm getting my undergraduate degree. And, you know, it's not like it's a big school. It's only like 1,200 people in the school. So I talked to the biology teacher, and he suggested that I apply to McGill, and I applied to Dalhousie. Well, I didn't do anything. I didn't do my MCATs. So I applied, and they both wrote back and said, you're accepted. Well, what happened was that I had also been offered to do something on the campus, and I wrote them both back, and I said, can I come next year? Can I come next year? Like, what a fool. You know? Two of the top schools in Canada accept me without my MCATs, and I'm saying, you know, can I come next year? And they said, well, reapply next year. So I reapplied next year, and they accepted me at McGill, and I went to McGill. And at that time, I chose that I had done my thing on campus. I was not going to get involved. I was just going to focus on becoming the best doctor that I knew how. At the same time, you know, I didn't have a good concept at that time what medicine was all about. My concept of medicine was the Norman Rockwell concept, you know, of the doctor sitting beside the bed, holding the patient's hand, you know, feeling the pulse, wiping the sweat from the forehead. Mine wasn't a high-tech concept of medicine, of becoming a high-powered researcher or even an academic. And so I, you know, really saw myself with a little black bag going from house to house, or people coming to my office. And so that's when I went into McGill, it was quite a challenge for me because it was truly a challenge to my intellect. You know, I don't think I'm a bright person. I think I'm a hard-working person. But, you know, I was challenged, you know, it was today medical students, and you know, I interrelate a lot with medical students. Medical students are taught to the level of recognition today. They're given multiple choice exams, and you have to recognize what's the right answer. You know, in my day, besides walking through the snow, we had to recall. You have no prompts. You had to write essays, you know, on adrenal disease, not, you know, what enzyme is missing, and then they give you a choice of 7 enzymes. You know, you had to recall it. And so every time I asked a professor, well, what do we have to know for the exam, the anatomy professor would throw out Gray's Anatomy and say, you have to know Gray's Anatomy. Yeah. I'd ask, you know, what do you have to know in medicine? They throw out Harrison and say, you have to know Harrison. And I know when they throw one out, you say, okay, but when they start piling up in front of you. And my first question was, and it actually, it pertains a little bit to what we're doing today in adolescent medicine, is that if it takes 15 specialists to come in and teach me that, how can one guy learn it all? You know, how can one guy learn all of those specialties? How can one person, you know, acquire all of that knowledge? And I remember coming into my first spot exam in anatomy. Everybody remembers spot exams where you jump from chair to chair and look at the anatomy, and they've got it all, you know, they got the arm looking like this and saying, you know, what does this nerve do if you cut it, you know? And I went in there, and I was so nervous, I couldn't write the answer. I was like this, I was like this. And every time the bell rang, ah! You know, and then you go to the next one. Anyway, over time, you know, I got through it somehow, and got through medical school with, you know, I think, you know, it became because I was Norman Rockwellian in my view of medicine. As we got into the second and third year, the first and second year were challenging because they were fact-based and they were, you know, knowledge-based, and the third and fourth year were performance-based. They were really clinical medicine. And as I got into clinical medicine, you know, I jumped from the bottom of the top third of the class up to the you know, upper part of the class. And it really gave me confidence that now I had made the right choice. For a while, I really felt that I hadn't made the right choice. And so off I went into medicine. Just, you know, I can talk forever about, I think the interesting part of my life comes in adolescent medicine, really. I mean, getting there was sort of an uphill battle. My legs were tired by the time I got to the top of the hill. But when I got to the top of the hill, I found it was worthwhile because I ended up in adolescent medicine.
So then you went to the Royal Victoria and your clinic there.
Yeah, I went to the Royal Victoria, and this is where the story of my affection for adolescent medicine began. First of all, I did a rotating internship, and everything I did in my internship I loved. And everybody I worked with in my internship wanted me to be in their specialty. The orthopod wanted me to take orthopedics. The OBGYN wanted me to do OBGYN. The internist wanted me to go into internal medicine. And again, I'm not that bright. I think I was just sort of showing a characteristic which I wasn't quite sure of. It was commitment to what I was doing and a love for the human dilemma, an affection for the patient. And I was almost going to go into OBGYN until one day I was in the clinic, and they used to give me all the hard pelvics to do. Not hard in terms of the exam, but hard in terms of the relationship. In terms of talking to the young woman or talking to the older woman about relaxing and allowing me to. And one day I was in the outpatient clinic, and they had this woman who must have weighed 350 pounds. And no one could do a pelvic on her. And so they said, give her to MacKenzie. So I went in, and I talked to her and made contact and did all the usual things. And then as I sort of asked her to relax her legs, and I moved in and sort of began to sort of do the exam of the external genitalia. And I just asked her to breathe quietly, and she was talking to me, and then I, did the speculum exam, and she was fine with that. She began to tense up. I can feel the tension in these huge thighs on either side of me. And I thought, I've got to be careful here. And she was fine. I got the specimen, did the pap smear. And then I was going to do the bimanual, knowing in my head that the bimanual was not going to tell me anything through this Lara thing. But, it had to be recorded, and you had to do it. Well, I slipped my fingers in, and I was palpating, trying to get some cervical motion tenderness. And she said, oh, honey, don't do that. And boom, in came those thighs. And I went like this. And I said, not OBGYN. That was not for me. So I moved on to medicine and I was a resident in medicine. And when I was in medicine, I was called to the emergency room one night when I was a second year. And they called me to see a young boy who was 16, a handsome young kid, blonde, who had taken an overdose of crystal meth. Now, this was 1967, 68, when, drugs were sort of a curiosity, their effects were a curiosity, the reasons for adolescents taking drugs were a curiosity. No one knew diddly squat about drugs in adolescence. And they called me because I was the medical resident, and they were going to find out whether I had to admit the kid or blah, blah, blah. So I went and saw this kid, and I was really fascinated by the question of why would somebody who seemed to have everything, and in a way, a little bit reflected on my life experience. I mean, he was from, a blue-collar family, but he had a lot more family trauma that sort of made him run away from the family, and he actually ran away to the circus. He was working in the circus when he came in, and he would sit around with the bearded lady and the fat man and the fat lady, and he took meth. And they were all sort of looking, and having a great time on meth. But he flipped out. Well, it ended up, as we held him overnight, and the next morning, he was really a nice guy. And I really felt for him, so I said, why don't you come back and see me in my clinic? Well, he did. He came back to see me several times in my clinic, and I was getting, he was drug-free. He wasn't taking his meth at all. And he was very agitated when he came back to see me. And I said, Don, what do you want to do? And he said, well, I'd love to be an artist. I'd love to do something like that. And he brought in his art that he'd created, a little portfolio. He showed it to me, and I thought, this kid may have some potential, but I'm not an artist. But I said, I don't think you can get a job as an artist, but another patient I'd taken care of was a big architect. And so I talked to him. When he came in to see me, I talked to the architect, and I said, blah, 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 blah. And he said, oh, yeah. He says, I'll help him out. I'll give him a job. So I gave him a job as a draftsman in his architect firm. And so Don worked there for almost 2 months, I guess. And he kept coming in to see me. And then one day he didn't show up. And I thought, I felt confident that he was safe. And I thought, maybe, you know, he's run away again. Well, you know, when he didn't show up, I thought, well, no, I won't say anything. And then I waited a week, and then I called the architect, and I said, you know, have you seen Don? He says, no, he's not showed up for work. And I said, oh. And so I waited the second week, and I kept asking after Don, because Don was disconnected from the major systems. I mean, he was on his own. He was working for the architect. Well, it turns out that Don had killed himself. And that's where I learned that you never take a coping behavior away from an adolescent without replacing it. And I had taken away his coping behavior. And I would bet you to this day, and I was not wise enough to know it because, you know, I was just a medical resident, and not much was known about adolescents at the time. But I bet you Don was treating his ADD with his methamphetamines because he was always fidgety, jumping around, and he had ADD. And on top of that, when he didn't have his amphetamines, which was taking his mind into another place, he had this terrible memory of his family history where his mother, who had entered into a new relationship with a man, wanted to have the house to herself, so called the police and said her son was stealing from her. The police came and took him away and was going to put him in juvenile detention, and that's when he ran away. So that was his memory that he could remember, and at the same time he was ADD, and at the same time I think he was feeling more and more lonely, and he was feeling more and more pressure put upon him, so he ended up committing suicide. Well, you know, because I took care of Don, I suddenly became known as the adolescent specialist in the hospital in internal medicine. Experience of one. Every time an adolescent came into the emergency room, they called MacKenzie. Now, you have to remember there was no textbooks in adolescent medicine. There wasn't even Pediatric Clinics of North America in adolescent medicine. There was very few papers